When you're sad and blue and everything is putting you down, you know the world keeps spinning around. You know you're not alone.
Yes, with MS, the world keeps spinning around, but you're not alone. Welcome to the 10 Minutes for MS podcast, in which we share information about MS in just 10 minutes.
Hello everybody, we have a very special guest today whose name is Dr. Gavin Giovannoni. He's a professor of neurology at Bath and London School of Medicine and Dentistry, and he's one of the top global experts in multiple sclerosis. So hello doctor, and welcome to the 10 Minutes for MS podcast.
Pleasure. Thanks for inviting me.
Thank you, Doctor, for accepting this request and to be here with us and help us answer some of our queries and doubts about multiple sclerosis. So, Doctor, since we are seeing that multiple sclerosis from a rich world's disease has now become a global disease, affecting millions of people around the world, do you think that MS is now an epidemic, which many of us are not realizing? And can this be prevented with proper awareness and education?
Yes, so what an epidemic really means is that the number of new cases, the so-called incidence, is rising. And obviously, particularly in lower middle income countries where the disease was very rare in the past, is now increasing massively. And we're seeing, particularly in young women, a massive increase. So there's something driving this increase. Some of the risk factors that cause MS are childhood obesity, adolescent obesity, smoking, exposure to the Epstein-Barr virus, low vitamin D levels. All of these things must be having an effect in lower middle income countries to see this increasing incidence. So we really need to do something about it, because there are things we potentially could do to prevent MS, and the next generation of people who develop the disease are not going to thank us if we didn't do the trials to prove that we could prevent MS.
Yes, absolutely. Yes, so we have to actually do something about it to stop this epidemic, which many of us are still not realizing that it is, but it is surely if we see the figures. So, Doctor, what do you think are the main challenges faced by the MS patients nowadays?
Well, it depends where you live in the world, but I've started this international initiative called Brain Health Time Matters, because it doesn't matter where you are in the world, there seems to be delays in the so-called pathway. So when people not only will develop their first symptoms, they often don't get referred in to get diagnosed for years sometimes. So there's always delays in the pathway. And even when they get diagnosed, there's delays in them getting access to treatment and getting access to highly effective treatment. So the biggest challenge, I think, is getting people diagnosed as soon as possible and onto effective treatments as soon as possible. And if they're not responding to those treatments, to get them onto more effective therapies as soon as possible. And I know this is a podcast for the whole world, but there are large parts of the world where these therapies are just far too expensive.
Absolutely.
And so the big issue people have in these low and middle income countries is affordability, because the healthcare systems don't pay for these expensive drugs. And is there a way we can bring therapies to people with MS that are affordable? And I think that's a big challenge, is affordability.
Yes, I'm so glad to hear this from you, because one of the main missions when I started this podcast, this community, was about, making the people aware about MS. Yes, that there is something in about MS and they should get the diagnosis early. Plus, if they have a diagnosis, what about the treatment? So many people can't even afford the treatment. So that's the main challenge. Yes.
What I wanted to say is that some of the most expensive therapies are protected by patents, and they're sold at high cost. But there are a lot of therapies that are available for other conditions, what we would call these off-label. They haven't been licensed for MS, but we have a lot of data, a lot of trial data that which shows that they would be effective. So I call this thing the essential disease-modifying therapy list for people with MS, and it's up to the healthcare professionals in low and middle income countries to use these cheaper drugs in MS, because they do work. There's no doubt these drugs work. And my personal opinion, it's better to be on one of these cheaper drugs than not to be on anything. So, if you do have MS and you can't afford those expensive therapies, you should be pushing your healthcare professional, your neurologist, to give you something that's affordable. And there are lots of affordable therapies.
Very well. So, doctor, when we're talking about therapies and affordability, nowadays we are seeing that there's a shift also when it comes to the treatments. Apart from just the DMTs that people are opting for, people are also opting for other things like natural medicines, lifestyle medicines, Ayurvedic medicines, and even stem cell therapy. So, what is your opinion on those therapies?
Yeah, so my personal opinion is those therapies should be obviously studied in MS, and a lot of them not studied. So it's very difficult to justify prescribing them or recommending them when you just don't know if they're going to work. Some of those treatments are associated with harms. Some of the herbal remedies, for example, have toxins, hepatotoxins that can damage the liver, for example. So you need to be very careful when using these other therapies, because they may have harms. But obviously, if they're not harmful and they are safe, I don't have a problem, and I would support my patients trying these other treatments, because you also got to recognize that in some cultures these therapies are really important. But the important message is they're not alternative. They're not instead of, they're in addition, and they're what I would call complementary therapies. And so, there's no point in stopping people from doing this, because they will go away and do it. Some people have different beliefs about their health. And I think it's important for neurologists to support them, but make it quite clear that these aren't alternative, they are complementary. And also, I would also avoid what I call quackery. There's lots of people who are unscrupulous. They want to make money, and MS patients are vulnerable, and they charge enormous amounts of money for some of these very expensive, unproven therapies. And I would resist that. If this therapy isn't being shown to be effective in a trial, they should be studying it in a trial, and you shouldn't be paying large quantities of money to get an experimental therapy. And you mentioned stem cell treatments. Yes, so stem cell treatments, depending on which stem cell treatments you're talking about, haven't been proven to be effective in MS. The one stem cell therapy that does work in MS is a thing called hematopoietic stem cell, where they take your own stem cells from your bone marrow. But those stem cell therapies are not given to repair MS. It's given to help you have chemotherapy to ablate your immune system and allow your immune system to recover and hopefully get rid of MS. And the stem cells are given to make your bone marrow recover quicker. So it's called HSCT, or autologous hematopoietic stem cell transplant. That's a different, because I think there's good evidence that works in MS, and we use it in our own center. But the other stem cell therapies, in my opinion, haven't been shown to be effective, and I would not pay large quantities of money to go and have unproven stem cell therapies, unless it's part of a trial. And if you're participating in a trial, they shouldn't be charging you. They should be doing it your participation should be for free.
Exactly.
Yeah, because at the end of the day, trials are usually funded by research budgets, for example.
Yes. Yeah, very well said. Thank you, doctor. So when one does the MRI, one thing that people are concerned about is the lesions. And when they read the report, either some of the lesions are active, inactive, or interval. So what does this different kinds of lesions mean, and how much significant are they in MS?
So they did. So depending on what type of MRI you have. So when you just have the standard, what I call the diagnostic MRI, you see on a particular type of scan these white blobs. Now that particular scan just tells you they're lesions. It doesn't tell you anything about those lesions, and it's called the T2 scan. They look white. They don't tell you if that lesion is new or old or whatever. Okay. Then there's another scan where it's called the T1 scan, and they often give you a contrast, an injection of a contrast agent. And if the blood vessels in those lesions are leaky, and that happens when the lesion's inflamed, the contrast goes, and they talk about enhancing lesions. And enhancing lesions mean that actual lesion's inflamed. It's relatively new, because lesions only enhance are inflamed for about 3 or 4 weeks on average. So if you do see enhancement in a lesion, that tells you that the lesion's active. That's what we call an active lesion. On that same scan, some of the lesions may look like they've got a black hole in it, and depending on if that lesion is old or young, so if it's a young lesion, that black hole may disappear. But if it's an old lesion and is a black hole, that tells you that that lesion's been more destructive, because under the microscope, if you could look under the microscope, that lesion is associated with more loss of nerve fibers, for example. So the so-called black hole lesions on the T1 scan, they call, are more destructive, and those are worse than if they didn't have a black hole, for example. So therefore, we have the T2, which is just counts the lesions, the enhancing lesions that tell you they're active, and the black holes, which are the ones that are more destructive. And then obviously the lesions can be hidden, depending on where they are. Sometimes the MRI scan can't see them. So on the surface of the brain in the gray matter, for example, and also deep in the brain in the so-called basal ganglia, which is also gray matter, we don't see lesions on our standard scans. Now you can do what I call research or different scans that can pick up some of those lesions, but in general we don't see those lesions on the so-called diagnostic routine scans we do. Now the whole purpose of MS treatments is to stop you getting lesions, because we know that inside those lesions damage occurs to the nerve fibers, and the more lesions you acquire, the worse the prognosis. So the idea with MS therapies is to try and stop you getting any new lesions, to be honest with you. And that's why that's why most centers now, we do annual MRI scans on people on treatment. We do one every year, and what we can then do is compare them to see what's happening to the number of lesions. And obviously, if you're in a therapy and you have a scan this year and you have a scan next year, you've got, say, 3, 4, 5 new lesions, that's telling you, if you're taking your medication, that therapy is probably not adequate enough. In other words, you've got activity happening despite being on a treatment, and that's usually an indication to switch treatments to a more effective therapy, for example. And what we do, we call it escalation. We would escalate your therapy to a more effective drug in the hope that you want to stop all your lesions from developing.
So, Doctor, how is this new neurodegeneration that happens? How fast can that be? And can that be controlled with any treatments?
Yeah, well, it's the same thing again. If you can get this disease diagnosed early and prevent lesions, stop it when you only got 2 lesions, say, then hopefully you won't develop neurodegeneration. Well, if you start treatment when you've got 50 lesions, those lesions have been associated with damage, and also the damage doesn't just stop there. The MS damage takes months to years to evolve, because inside a lesion, some of the nerve fibers are cut and then die off. Other nerve fibers are damaged and they recover, but they always have to work overtime. They compensate, and what happens is they die off over time. And that's why people with MS have got to understand, if you go onto a treatment, even though the therapy may be very effective at stopping you developing new lesions, the current treatments don't go in and repair those old lesions. They're not designed for that. These are so-called anti-inflammatory treatments, and they stop inflammation, but the old lesions continue to degenerate. And that's why some people may find that even though they're on a therapy, they may still find things getting worse. Their walking may be deteriorating, or they may be developing new symptoms. And that could also be due to the old lesions just getting worse. Other things come in into play as well. People with multiple sclerosis get older, and as you know, as you age, your nervous system ages as well, and that's degenerative. And so there's aging mechanisms. People who smoke also degenerate quicker. People with high blood pressure, diabetes, all the things that I would call are what we call brain health, are bad for your brain health, can make MS get worse quicker. So it's not only about switching off inflammation, but it's what can you do as an individual to stop yourself getting all those other things that can impact on your brain health. And that's why we have to manage MS, what I call holistically, not only focus on treatments for MS, but also focus on therapies that can improve brain health.
Absolutely. That's the reason why we have to take care of our lifestyle and our habits, so that you feel better. Yeah. You don't just depend on DMT and say, "Oh, I'm on DMT and I'll be fine." Yeah. So one of the lifestyle things that I really do stress for all my patients, even if you're a little bit disabled, or even if you've got a lot of disability,
is exercise is a remarkably good thing for the brain. Now, it's beginning to seem like in MS as well, but even in the general population, people who exercise, they delay getting a dementia, for example, when they're older, and losing memory, for example, because exercise is neuroprotective. It actually affects the brain by stimulating a whole lot of growth factors and neurotransmitters or chemicals in the brain that are good for the brain. So it's really, really important if you have MS to try and do regular exercise. And unfortunately, regular exercise means just that. I tell my patients they should do 4 or 5, and if possible, 6 times a week. The best therapy is probably HIIT. It's called high intensity interval training. Some people prefer doing, a gradual, what we call aerobic exercise, and you should probably do, half an hour of that at least. And you should push up your pulse when you do that. So people, I'm not saying maximum, but people say you should probably do it at about 60 to 70% of your maximum estimated pulse rate. And so that's a big commitment. You've got to actually work into your day, work into your week, regular exercise. But if you do that, the benefits are unbelievable for you. So, and I've even got people who've got in wheelchairs. They go off to the gym and they do upper arm exercises, weights, and they use this little exercise, this hand bicycle, and they describe massive improvements in their functioning, based on just exercising the upper body, and it gives you a good cardio workout as well. So, take the message from me that exercise is probably the most unprescribed, underused disease-modifying treatment we have for MS.
Absolutely. So, Doctor, when we're talking about exercise, one more question came in my mind, which is most debated about, which is diet when it comes to gluten and sugar and dairy and processed foods. So, what's your personal opinion about gluten and these things?
Well, yeah. So I just don't think there are any diets that are specific that are specific for MS. Okay, and I run a new website that I've just created, a new thing called it's called MS Selfie for self management, and this is very topical. I've just done a post on this exact thing. So I don't think there are MS site where I send out emails to patients called MS Selfie, and the whole purpose of the MS Selfie is to educate people to self-manage. Selfie means self-manage MS. And I've just done a post on diet, and I make the point that there are no MS diets, full stop. There are diets for general health, and there are principles about what's a good diet. And basically what you should avoid is processed and ultra-processed foods. If you can eat real food, you should. And all these diets of, should you be vegetarian? Should you be gluten-free? Should you be vegan? Should you be pescatarian? This is all not proven. And I think you have to personalize your diet based on your lifestyle, how you live, and your social and obviously economic factors come into it. Some of the diets that are proposed by various people to treat MS are very expensive and difficult to stick to. Saying that, though, there is evidence now, and this is where, are there anything we can do to treat MS with diet? And there's an emerging body of science, mainly from animal studies and other disease areas, that intermittent fasting, and also ketosis, making yourself ketotic, where you produce ketone bodies, that's from low carbohydrates, maybe have beneficial effects on the brain of people with MS. And, so a lot of people are doing that anyway. There's this big trend, particularly from America, called biohacking, where you actually hack your own biology. That's what it refers to, by manipulating your diet to try and promote these positive effects. And I personally think the evidence from animal studies is very compelling. Okay. So if I had MS, I would almost certainly try one of those to see how you feel. The thing about it is, though, it's not easy to fast intermittently, and it's also not easy to be on a ketogenic diet. Yeah. But and I don't personally think the ketogenic diets need to be long term. You could probably do them intermittently, you see. But anyway, let's watch this space. The good news is that there's quite a few academic researchers that are testing these diets formally in studies. They're actually putting people on intermittent fasting, and they're putting people on ketogenic diets. and to see how they do. So we hopefully will get an evidence base and be able to recommend certain diets for people. But I just want you to be sensible about diets. Don't go out there and accept anything what anybody says without checking it out. And even don't take my advice at face value. What you really need to do is do your own research, and you should go to many different sources and get a consistent picture around, dietary advice before making a decision to change your diets. And one of the things I always say is, eating is not just about eating. It's a social event.
Okay.
We have to eat with our friends and our family. If our diets stop us eating with our friends and family, then that's not a good idea. I also think we should eat locally. We should try and eat food that's grown in your own country and with your own farmers. It's no point in eating food that comes from all over the world and you've got a carbon footprint. We're trying to prevent global warming, for example. And we should probably be aware that, in the past, we used to eat seasonally. There were different foods in winter and summer. And, the latest food environment, there are no seasons anymore. And it's probably not good for us. We shouldn't eat too much carbohydrates, sugars, for example, all year round. In the past, our ancestors tended to eat the sugars, mainly from fruit and honey towards the end of summer. The rest of the time, they had very little carbohydrates. So they're sensible things to do. Anyway, read my MS newsletter on this and make up your own mind. But I do think you can't ignore diet. We are what we eat, and a poor diet impacts on general health and will impact on your MS. So lifestyle issues are critical to focus on. You can't ignore them.
Right. Thank you so much, doctor. This was a great advice, because even we say that everybody's body is different. You just can't follow blindly what the other person is saying. I've stopped gluten, so I also stop it. It's not like that. You have to know what your body wants, right? And like you said, it has to be locally. For example, if it's said that I stop eating wheat, it's not very much possible for me because I'm from India and wheat is my staple diet. So of course it is difficult. And same with the people in Italy. It's different. It's difficult for them to stop eating breads. So everybody's body is different.
I mean, what you can do, just to take bread, for example, the way we used to eat bread, we used to have what we call slowly fermented sourdough, which is, the old way of making bread. Nowadays, big bakeries have used what they call a fast ferment. They actually add sugar and they use a monoculture. And so the bread ferments and rises very, very quickly, probably too quickly to affect gluten, break down the gluten properly. And so there is this theory from people who work in inflammatory bowel disease and inflammation in the gut that the modern way of making bread is possibly not as healthy as the old way of making bread. So, even when it comes to wheat, it's how you eat the wheat that's important. So I personally would recommend we go back to our ancestors' ways of making bread, which is slowly fermenting it over many, many hours, rather than this fast fermented bread that we buy now from, the big bakeries that make it at an industrial scale. We need to actually think about the type of food we eat as well.
Thank you, doctor. Doctor, now coming back to MS, so is there any therapy which can help us in remyelination? Can that be possible?
Yeah, unfortunately not. At the moment, we don't have any licensed treatments to give you that remyelinate the brain. But we do know from other areas that exercise rehabilitation promotes recovery. And that's part of recovery is remyelination. So yes, I'm saying that rehabilitation, exercise, doing things help. So let's say you've got a problem in your hand. If you don't use that hand, it will never recover.
Yeah.
So if you have an attack and you've got a weak hand, you've got to do exercises and increase the complexity. And then what will happen is you'll promote in the brain recovery of function. Part of that recovery is remyelination. And we do know that using the part that's not working properly promotes recovery of function. So exercise and rehabilitation, in my opinion, is a remyelination therapy. The other thing we know is if you treat the disease very, very early, particularly with the more effective therapies, spontaneous recovery occurs and people recover function. So that's the other thing is DMTs, particularly when used effectively early on, promotes recovery of function. It's not primarily a remyelination, but we know from looking at the lesions that they remyelinate and there's recovery of function. If you wait too long and you let people get older and you don't treat their MS properly, then you miss that boat, because what predicts recovery of function in people with MS is how young they are when they're treated, and also how disabled they are. If they're not that disabled, there's much more likelihood of getting recovery. So, the overriding message is treat early and treat effectively.
Right. Thank you, Doctor. Doctor, other question I have, which is, I know you have spoken about this in the earlier summits as well, is about food coma. And as we know that many MS patients do suffer with it. Can you please help us understand why does this food coma occurs and how can one manage it?
Well, food coma is kind of normal. So everybody who eats a big meal feels very tired after eating a meal and wants to sleep. It's called the siesta syndrome. And we begin to realize it's got to do with carbohydrates, and it causes your body to produce hormones, particularly insulin. And insulin goes into the brain and it stimulates the brain to want to sleep. So that's what we call postprandial hypersomnolence. It's food coma. Now, I don't know why, but people with MS are more susceptible to that, and they get it more severely. So that what they find is when they eat a big meal or eat carbohydrates, or it's typically a big meal or carbohydrates, they find that their brains fog up and they feel extremely tired and sleepy after a meal. And so the way to avoid food coma is to try and if you have to eat a big meal, eat it in the evening and then you can go to bed and sleep. If you're functioning at work and you need to think in the afternoon, it's probably worthwhile making sure you eat a very small meal. And if you do eat a small meal, you may want to avoid carbohydrates. Make it a non-carbohydrate meal that doesn't stimulate the hormone insulin, because carbohydrates are sugars, and it's sugar that primarily stimulates insulin, which is the driver of food coma. But I was quite surprised. One of the reasons why I got interested in this was because one of my patients she's a high functioning woman working for a news agency, and she's got a big job, and she just couldn't function. So she doesn't eat anything for breakfast, she doesn't eat anything for lunch. So she basically is intermittent fasting, and she eats her all her calories and her big meal in the evening because she just can't function because of food coma. She's the outlier. There are other people, but there are other people who have the same problems. So I've actually noticed it myself. So I'm now I tend myself to miss out on lunch. I'd very rarely have lunch on a weekday, simply because I noticed that if I did have lunch, my productivity, and I'd feel very groggy and tired about a half an hour to an hour after starting or eating. So now I avoid lunch.
All right. Yep. And then what about evenings? Do you have any kind of beverages, tea, coffee, something in the evening, or just directly dinner?
Yeah, so another thing that's important for people with multiple sclerosis is caffeine is a stimulant, but it also irritates bladder. And people who've got bladder problems shouldn't have caffeine too late in the day. So I tend to try and stop having caffeine at about 2-3 o'clock in the day. Simply because I know that the half-life, it hangs around the body a lot longer, and it potentially keeps you awake and stimulates you at night. You say beverages, I tend to avoid caffeine beverages in the evening, and if I do have tea, I usually have a herbal tea. That's what I usually have in the evening rather than proper tea, because proper tea's got quite a lot of caffeine in it.
All right. Thank you, Doctor. So my last question to you would be about the ongoing pandemic. So do you think that after COVID, there will be a change in the way the DMTs are used? For example, Ocrevus is immunosuppressant. So is it safe to say take such drugs, such DMT, even during the time of pandemic?
Yes, I think what will happen is people will think more carefully about infectious complications and vaccines, that being able to respond to vaccines. But I think that class of treatment is one of our most effective classes of treatment, and we need that, because at the end of the day, all of the what I call high efficacy treatments really are immunosuppressive, affect the immune system, and there's no getting away from hitting the immune system to treat MS. So I don't think that we will change our practice very much. I still think we'll use all those drugs simply because they're very effective. They're relatively safe in the short term. I don't know how safe they are in the long term. I've got worries about these treatments like ocrelizumab, rituximab, ofatumumab. They block the B cells. I've got a slight worry about being B cell depleted for decades, particularly in older patients. We start seeing infectious complications and getting serious infections arising. And I think we are going to think a lot more carefully about the issues that the COVID pandemic have put in our heads. And, but I think that would have happened anyway. Our thinking would have happened anyway, not necessarily, it's been sped up by COVID-19. But if you need to have one of these highly effective therapies, you need it. At the end of the day, the risk from COVID-19 is slightly higher chance of getting severe COVID-19, not a big increased risk. And so, yes, I think we need to put it into perspective. Much more important for me is treating MS. So one of the problems about COVID-19 is we've been under-treating MS. And in some parts of the world, not treating MS. So I think that, to me, is the bigger risk, is under-treating or not treating MS. Because you worry about COVID-19 when the risks are quite low from COVID-19, but the risks from untreated MS are much higher for the individual.
Absolutely, very well said. Thank you so much, Doctor. Thank you so much for all your kind words and sharing so many details about MS. And we believe that being aware, informed, and educated is really important. And you have shared such interesting facts about multiple sclerosis and making us understand about this disease more properly. So thank you so much for your time, and it was lovely talking to you.
It's a pleasure. You take care. Bye-bye.
Thank you so much, Doctor.
Thank you, warriors, for being with us. I hope you found this session useful. We will be back again next week with another informative session